Okay, so today we're going to talk about relational cultural therapy. And to start, let's talk a little bit about why theory is important. So theory is important because it provides a framework from which a therapist can work with a client. It assists in the interpretation of a disorder or challenge that a client is facing in their life, and it also offers methods of treatment. Practicing counseling without theory is like walking across an open battlefield without any strategy. You don't know where the booby traps are or what the most reliable routes are to a safe destination. So it's really important to practice with theory because it means you have a strategy and a map to walk across that mental battlefield, so that you as a therapist and the client can both come out on that other side safely.
All right, so a little introduction to relational cultural theory, which was founded by Jean Baker Miller, who is a psychiatrist. It was first written about in her book Toward a New Psychology of Women in 1976, which was during the height of second wave feminism, which is a huge contextual factor in the forming of this theory. All right. So she studied psychoanalytic theory in her studies, and then this really valued individualization, separation, and autonomy as markers of emotional maturity. But she primarily worked with women, and she noticed that these values didn't necessarily pertain to women, nor did they help them. Women, she noticed, took on different roles in society that required them to be in important relationships with other people, given their roles as housewives. And then in lower income communities, women who relied on neighbors and relied on those relationships to take care of each other and rely on each other. And so she found that she needed to find a new theory that helped women and based the therapy out of those relationships rather than focusing on simply self-sufficiency. So this is a quote that I pulled from the abstract. A new framework is proposed in which qualities such as cooperativeness, giving, and serving, traditionally defined and thus devalued as feminine, are instead viewed as potential strengths. The female's affiliative need is seen as a particularly fundamental organizing principle essential to the achievement of women's human potential within the context of interpersonal relationships. While this was originally founded as just a feminist theory, and particularly white feminist theory, it now encompasses pretty much every facet of culture and every cultural identity.
Right. Okay, moving on to some theoretical assumptions of RCT. So again, the big part of RCT is really looking at the self in context, and really looking at how that sense of self, that strong sense of self, is developed through meaningful relationships and having a mutual connection to other people. There's this belief that psychological maturity is the ability to enter into more and more complex relationships and mutual relationships with others, and that it's less about becoming independent and autonomous. So again, key really is that interdependence is that developmental pathway in order to achieve a really complex sense of self and to be able to enter into intimate and healthy relationships with others.
So some assumptions that the theory makes about the world is that humans are inherently impacted by their sociocultural and socioeconomic conditions, as well as their sex roles, which impact everyone, not just women, and that essentially humans don't thrive in isolation. So self-sufficiency is great, but humans need relationships to thrive. And so there's really a focus on contextualism, interdependence, and a collectivistic approach, rather than something like multicultural theory, which focuses on multicultural competency. While that is important, what really is the focus in this theory is the context and the interdependence.
Okay, so moving on to problem conceptualization within RCT.
So the main problem that's really the backbone of RCT is isolation. So condemned isolation. When someone is not seen or appreciated, they don't have the ability to grow. So not recognizing that people are parts of relationship and valuing relationships don't allow people to grow. This really comes into context in the greater culture, which is where dominant groups isolate non-dominant groups by only accepting their point as reality. So as psychoanalysts had accepted individuality and self-sufficiency as their reality, didn't encompass those non-dominant group identities. And that applies both in the sociocultural context, but also in the relationship. So being seen and appreciated in a person-to-person relationship is essential in this theory.
So that isolation really leads to disconnect within our relationships. And when we're disconnected from having meaningful relationships with others, that is what leads to growth inhibition. So the inability for you to really grow as an individual. So when the key qualities that are required of a growth fostering relationship, which we'll get a little more into later, leads to not having that interpersonal connection with others, feeling isolated, internalizing negative images about what relationships should be, or how you should be in a relationship. And then ultimately that all leads to that psychological distress that weighs on a person. So why do strategies of disconnection happen? Why do people become isolated? So RCT really conceptualizes this problem as coming from an individual's need for safety and acceptance from others. And so in order to survive and have that safety and acceptance, an individual might not feel comfortable truly sharing their real thoughts, feelings, and experiences in a relationship for that fear of rejection and not having that acceptance. And so they'll hide those parts of themselves. But when they do that, it leads to a false sense of self-acceptance in their relationships. And so really that can be summarized by this idea of the central relational paradox, where an individual, in order to really needs authentic relationships in order to be fully mature and fully realized. But in order to gain that acceptance from others, they almost have to self-protect and hide certain parts of them. But then that leads to that inauthenticity within their relationships, which means that they're not entering in those meaningful relationships that really give them that sense of connection to others and that sense of well-being. Okay, so moving into the counselor's role in RCT. So the counselor plays a key role in really being able to hold that space with the client, acknowledge the cultural context from which they came, validate and incorporate that client's cultural and social context. It obviously requires them to be culturally competent. Another critical factor is for that counselor to really enter into a collaboration with the client. That's really key to what this RCT relationship looks like between a therapist and client. And in that collaboration, what the counselor is really doing is trying to help the client understand what those patterns of disconnection are in their life, and try to honor those strategies, not as strategies, not as a way of looking at them negatively, but as a way of saying, you know, this is how you disconnected in order to preserve yourself. But through the relationship, through the therapeutic relationship, they're really working with the client to model, okay, this is where the disconnect happened, but this is also in our relationship how we're modeling how we can move past disconnect to connect. So they're really providing that framework for relationship building skills through the alliance. It's really critical for the counselor to engage in self-reflection in RCT. Because of the sensitivity of the relationship and to power dynamics specifically, it's really important that the counselor self-reflects on their own so that they can become aware of their own personal privilege and how it's impacting the counseling relationships and process.
All right, so to expand a little bit on what Angela was saying, really fostering the relationship is the key of RCT. And along with just that self-reflection that you're making about your own privilege and your own biases, recognizing and naming that privilege in therapy is going to be essential, and that's how it kind of differs specifically from what we'd see in a typical therapeutic reliance. And then you also view the client as a capable collaborator or an equal. So this theory is really egalitarian in that sense that both people are getting that mutual empowerment and that mutual empathy. And so it's really based on that relationship, and it's a little bit more of a two-way street rather than it just being single-sided, although it's heavy-handed in the client's perspective, of course. But the counselor themselves really need to have a willingness to be impacted by the client and be impacted by the relationship that they're forming. So in a sense, it's kind of this meta counseling. And it really focuses on change over adjustment. So meaning rather than adjusting to the society, focusing on change in the relationship and how that client is going to bring change into their other relationships, not just the one formed by the counselor and the client.
Right, so a way to summarize that so that a client can be clear about what are the tenets of a meaningful, authentic relationship. There's 4 key ingredients that they should be experiencing in the relationship with a therapist, but also taking to the relationships outside in the rest of their lives. So those 4 key ingredients are mutual engagement and empathy as the first. And that's really important for the therapist and the client to both be willing to be impacted by each other, because that allows for the the power differential to be overcome. So you're kind of on level footing, like Madeleine was talking about. The second key ingredient is authenticity. So especially for the client, if they're not having those authentic relationships outside, for them inside the relationship with a therapist to be able to really express their true thoughts and feelings, knowing that bringing this authenticity forward can impact the person that they're with. The third key ingredient is empowerment. So again, that sense of being able to walk away from the relationship, feeling a sense of personal strength and inner capacity for action. And then the final key ingredient really being that ability to process any differences and conflicts within the relationship. And that's critical within the therapist and client relationship as a way for the client to really be able to see how to work through any disconnect. And so it's important that the therapist, whenever there is a rupture in the relationship, and it's expected that there will be, that they'll address it, and then they can work through it together. And again, they're kind of modeling what that pattern of connection, disconnection, connection can look like in a way that it can lead to healthy relationships. Okay, so moving on to the intervention framework.
So really, in this one, it's a you pick. The intervention framework in RCT aligns well with psychoanalytic interventions because it came out of psychoanalytic theory, but it doesn't specify, it doesn't list out any specific interventions. But applying the interventions with an RCT framework is where RCT is really going to come in. So you might prioritize the relationship in RCT over self-advocacy or self-worth. So seeing how the relationship pertains and how the relationship is important, prioritizing that, making that important to the client. How are you affecting this relationship? How are you contributing as a way to foster change rather than simply shaming or working through things at an individual standpoint, as a separate standpoint. It really focuses on that interdependence.
So some of the key work within that, within the intervention is really about working through relational disconnections. And again, like I'd mentioned before, between the therapist and client, what that looks like is kind of working through any negative relational images that the client has, but then also looking at patterns of disconnection, and whenever that disconnection does arise within the therapeutic relationship, that is tended to, and that the therapist really is willing to be responsive and authentic and acknowledge their own role in that rupture or in that disconnection with a client. And in that way, they're really modeling how you can move through disconnection in relationships. And so that's the key. The key work is to be able to show what does a rupture and then a reconnection look like in a meaningful relationship that has those key ingredients, so that a client can then see that, experience that, and be able to carry that forth. And out of building that strong alliance and relationship with the therapist, the client will be able to develop a strong sense of self that they can move forward with.
And then really the overarching goal in a way that you can come into RCT with specific interventions is mutual empowerment. So acknowledging the overlap between sociocultural and socioeconomic issues in the client's life. So acknowledging how those cultural contexts really affect the client and talking about them. Acknowledging the sex roles in both men and women. So understanding how those sex roles pertain to their life, how to challenge them. And then also how to understand them and just talk about them. So the intent of a lot of these interventions that you would use is to underscore those rigid sex roles. So by talking about them and by acknowledging them, the counselor is kind of feeding the client information to underscore those sex roles and to talk about them in kind of a meta context.
Okay, so some common factors.
All right, so these are just going to be a lot of the common factors with everyone involved. That's going to be empathy, authenticity, collaboration, transference, a therapeutic relationship, and corrective emotional experience. So really, this is what we find in a lot of theories that overlap. Specifically, transference is taken from psychoanalytic, but otherwise, they're all really applicable.
So there's a nice overlap of those common factors into RCT, which is really wonderful. So a quick look at our sources, but that's our take on relational cultural therapy. Thank you for coming to our Zoom talk.